Hello, everyone. Thank you for joining us today. My name is Luisa Espinales, and I am going to be providing you with a beneficial webinar. We have Dr. Carlos Estevez from Pfizer joining us here today. We're going to be talking about Duchenne Muscular Dystrophy.
Hi, Lisa. Thank you so much for today. It's my pleasure to share with you and explain what is Duchenne muscular dystrophy.
Thank you for joining us. So, I have some questions for you. I would like to start with question one. What is Duchenne Muscular Dystrophy?
Well, Duchenne muscular dystrophy is named as a rare neuromuscular X-linked disorder. X-linked means that the transmission of the disease is when you have the alteration or mutation in the X chromosome when a specific portion that is developed and built the dystrophin protein. When you have this protein that is not working well, or maybe you have an issue in order to have a good function, unfortunately, the muscles that is located in the skeletal muscles in the body, the respiratory muscles and the heart, have a big issue in order to remodulate it and also in order to preserve the correct function of the muscle cells. And then unfortunately destroy, and you have different kind of signs and symptoms that start in the childhood and go to the adulthood.
Okay. Okay, thank you for that. How does Duchenne muscular dystrophy affect your body?
Okay, that is a good question in order to follow up. First, we need to understand that the problem is the lack of this protein that is the dystrophin. The dystrophin is a natural protein in your body, and especially in the muscles, that help us in order to reduce the impact of the movement in the muscles. This protein connects the membrane of the muscle with the sarcolemma, that is the function, the big function of the muscle, and then coordinate everything in order to establish in a good accommodation. When you have the lack of the dystrophin, it means that you have a strong uh, problem in order to support the muscles, and then this huge punch in the muscles in the middle of the membrane destroy the muscle, and then convert in the beginning for adipocyte tissue, and then finally is a fibrosis. When you damage the muscle and go into fibrosis, you start to decrease the function of the muscles. In the case of the Duchenne muscular dystrophy, usually they start in the legs. Then you have two problems with the ambulation. Then continue to go with another muscles, that is the respiratory muscles. And unfortunately, when going there, you can stop and have a problems with the breathing, and then continue with the heart problems in the muscles. And then you need to get a good monitoring and follow up what happened with the heart in the patient that suffer for the Duchenne muscular dystrophy. In the summary, we have a problem that started with the ambulation, then continue with the respiratory issues, hair problems, and then also you have the problems with the upper limb. That also reduce the function of the upper limb.
Okay, thank you for that. So, I do have another question for you. What population is mostly affected by Duchenne muscular dystrophy?
Well, as mentioned in the beginning, is an X-linked disorder. Maybe we need to go for in the baseline. The women, the mommy, is 46XX. That means they have a 2X chromosomes. But the men have 46XY. For the reason is important that the woman have a duplicate the information in the X chromosome. When you have one X chromosome with a mutation and the other is a normal function, you have the carrier. You usually are the carrier. However, also you have a symptomatic carrier in the women's that maybe have a little manifestations of Duchenne muscular dystrophy, especially in the heart and sometimes in the muscles. When then the mommy then can transmit, inherit this condition to the boys, because the boys have only one X, that in this case will be the mutated X with the problem in the dystrophin gene, and then you have the Y that have the same information that the X. For the reason is more affected in the boys. However, as mentioned before, the carriers also maybe will be potentially symptomatic sometimes, because in the natural, in the random way, one X chromosome is diminished the function and the other X chromosome is continue active. When the X chromosome that is active have the mutation, also we can have the disease in the women's. For the reason that is the difference. In summary, we can say that the mommy that is the carrier have the 50% of probabilities to get the inheritance to the boys with Duchenne muscular dystrophy.
Okay. So I have a follow-up question to that. So is Duchenne muscular dystrophy inherit?
Yes, most of them, yes. Two-third parts of the Duchenne muscular dystrophy is inherited by this X-linked, but one-third is a spontaneous mutation. And that is a big problem when you have you need to get the correct diagnosis of the disease. Then also it's important to mention in general terms, the prevalence of the disease is around 1 in 3,500 males. But then also is calculated now in the global epidemiology, and also because the diagnosis improved across the world, maybe you have reported around 5 to 7 per 100,000 patients with the disease. And is usually calculated also in the incidence that is around 90.8, 100,000 male live births. In the case of the USA, it's calculated according to one publication in 2019 that it have in the incidence 360 new cases per year, and then in the total prevalence is described more than 10,000 patients that is affected for the condition. When you have the third tier that is affected inheritance, you have usually familiar history about the disease, and maybe it's more easy in order to get these alerts in order to conduct the specific testing in order if you know it's the carrier, or maybe you go to the child that have a sign and symptoms and then go for the genetic testing. But this is one tier of population that is a spontaneous mutation, and you don't have a familiar history before, is really the real challenging in order to get an early diagnosis, because early diagnosis is better outcomes.
At what age do children start to show symptoms and signs?
Well, in the case of the dystrophin gene, because it's a big gene in the nature, you have the possibilities of many mutations. It described many mutations in this DMD gene. For the reason depends of the severity of this mutation, also is the severity in the clinic, or the usually named phenotype, that you have a mild disease or you can have a severe disease. Usually, the average age of the symptoms is around 2.5 years old. However, if you have a severe condition, maybe you can get the first sign or symptoms at 4 months old. In general terms, we need to say that if the parent, the caregiver, see any problems in the development of the kid, that usually have a delay, for example, in order to get the motor development, or maybe they see that they have a problems to climb, to walk, or maybe have an current falls, it's important to see what happened in this part and then consult with the primary physician, with the pediatrician, in order to know what is the next steps. Maybe this is a condition that is related to a specific disease. Maybe the problem is they need more therapies or more stimulus to the kids, but that is important portion. And then we're talking about the teachers in the schools. Also, it's important that if the teachers or the nurse in the school is start to see this kind of signs and symptoms, also it's important to get the red flag and then say what happened now with the kid, and then try to get an early referral to the primary physician, and then the primary physician get a good referral to the specialist in order to get the early diagnosis and correct diagnosis of this condition.
So, what are some of the signs and symptoms that maybe the teachers and the parents or the nurses in school can flag and can be considered as a red flag?
Well, that is a very good question. When they have the infancy in the childhood, it's important to see what is the usual development of the kids. And maybe you have in your family or in the school another peers that maybe have a specific development. And maybe you see they have a problems in order to have a delay in this in this usual pattern of the milestones is one of the red flag. Then when the kid is sits, for example, and then you can help him, you have different kind of signs that you can see what happening with the kids. The first one, for example, is if you get the hands and then you try to move in a sit position, but the head is still with the in the back side. That means that you have a atonia or hypotonia of the muscles. This head flag sign maybe will be one of the first one in around the 15 or 18 months old. Then when the kid starts to walk, that is around in the same age, also you can see that the kid start to have a balance walking, or that is the duck walking, and you can see that he's trying in order to keep the correct position, and maybe that means that you have a problems also in the muscles. Then when the kids are still growing, also you have a description that is specific maneuver, that is the name of the ghost maneuver that was described in the past. And when the kid tried to move from the on the bed of the sitting position to the supine position or the stand position, he tries to do it in a different ways in order to support the muscles. That is another way in order to understand that maybe you have a problems with the tone of the muscle, of the strength of the muscles. And then when you see this Wower's maneuver, also is a good sign or that something's happened with the muscles. And then, as mentioned before, if the kids try to get a step or get another step, maybe also you see that is a frequent falls. And that is another kind of sign that maybe you need to put attention on this. As you see, that is a general signs that maybe you can see that is related to the lack of straining the muscles, with the problems with the deambulation, and then maybe you need to go to the pediatrician asking for a specific test and then get the final diagnosis of the disease.
Okay, thank you. What is the importance of early diagnose?
Well, that is so important, the early diagnosis, as the same happens with any kind of rare disease, any kind of orphan disease. The early diagnosis means early treatment or better treatment of care. And then finally, that means better outcomes. If we define what happened in general terms, we see that the first is important due that the parents have informed decisions. Because if you have a familiar history of the disease for the Duchenne Muscular Dystrophy, maybe you get in advance and you have a specific test in order to see if the mom is a carrier or not. Also, you have a familiar history of the disease. Also, it's important that maybe you have a correct genetic counseling pre-pregnancy in order to see what is the test that you can apply by yourself, or then also when you have during the pregnant in the pregnant periods. The other part is that is early access to the standard of care. So far, is not a specific treatment available for all of the patients, but you have a specific treatment that help the patient in order to stop the deterioration of the muscles. That also this help a lot in order to get a good management of care. That means better quality of life. That means that you have a good multidisciplinary team, close monitoring of the patients in order to ensure that everything works well. You can identify early signs or symptoms in a specific tissue or organ that maybe you need to get a specific treatment for this problem in the heart, for example, in the respiratory. You need a respiratory equipment in order to support the kids. And then finally, also because in the last years, in the Duchenne muscular dystrophy environment, increase a lot the research. Also, maybe you get access or eligible to participate in a clinical research. And then if you have a specific mutation and a specific profile, that maybe you can get advantage in order to get access to the treatment for this specific mutation related to the treatment of the Duchenne muscular dystrophy. As you see, the early diagnosis is so important in order to improve all the full quality of life in the holistic point of view, and also help in order to get access for the research. I think Lisa, that you're on mute.
Sorry. Thank you so much. What are some of the tests and procedures that are done to determine if your child has Duchenne muscular dystrophy?
Yes, well, it's important to mention that we describe now, for example, is not a is a supplement that maybe you can discuss with your healthcare professional, because it's important if you have the primary physician follow up with this healthcare professional in order to ensure that everything is according the natural history of your child, or you get the correct diagnosis of the child. Well, now with the new approach and the advance of the scientific point of view, the genetic testing is more available and broadened in order to get access for the kids that maybe you have the suspicions of the disease. First, you have these red flag signs and symptoms of the kids. Then the pediatrician or the primary physician can get a test that is a general test that also is used in the newborn screening, that the name is CPK. Then this specific that's going in the blood sample, when you see that this CPK is in the high levels for the normal range, maybe you can get a suspicious of these muscular problems because the CPK is high in this kind of muscular diseases. Then when you have this suspicion plus the clinic of the patient, then go to the genetic testing. You have a specific genetic testing in order to see what happened with the disease of the gene. For example, in the family was identified previously and a specific mutation, maybe you got to evaluate this specific mutation by genetic testing. But then if you don't find this specific mutation, maybe you can open and get a full gene sequencing. And then you can identify that you have another mutation that maybe is the reason or you have the problem with the dystrophin protein. If it's not available, maybe you have the specific gene is not, you don't find a specific mutation. Go for the full genetic sequencing, you have the specific mutation, but you have the clinical history. Maybe you have a familial history. It's important to get a biopsy of the muscle. And then with the biopsy of muscle, you see if the dystrophin is produced in the muscle, what is the configuration of the muscle, and maybe you get the final diagnosis. And then when you get the final diagnosis, according to the specific mutation, maybe the patient is eligible in order to receive a specific treatment or not. That is the sequence that usually you need to follow in order to get a diagnosis of kid with Duchenne muscular dystrophy. But also you have the potential career. If in the family you have a specific genetic disorders, you have a familiar history of Duchenne muscular dystrophy, also the mommy can get the test before to get pregnant in order to see if there's a career or not. In the past was also to manage the CPK. However, is really hard to interpret it in some cases. For the reason now, because the genetic testing is more available, you can go directly to the genetic testing in order to evaluate you have the specific mutation of Duchenne muscular dystrophy, and then also you have the genetic counseling in order to ensure that what happened with the next steps before to get pregnant, or then during the pregnancy in the prenatal test, also you have the option to go for a different invasive or non-invasive procedures.
Perfect. Thank you so much. This information has been very beneficial. I think that you've provided us today with a big lump sum of signs, symptoms, and education to make sure that we're on the right path to, early diagnosing, early treatment. Is there anything else that you think that would be beneficial for parents to know before we close out?
Well, I think that is important to keep alert in all different signs of symptoms that you see that is described about this disease. Now, currently, as mentioned, is some treatments available by clinical research or some treatments available for specific conditions for people with this Duchenne muscular dystrophy. And if you go to the primary physician, is a very good idea. According to different facts, 80% of the patients or the caregivers that they have a specific suspicion that something is wrong in the development of the kid, they have the reason. It's 80%. Also, if you have these kind of red flag symptoms, and if you go and discuss directly with your physician, also you have the opportunity to reduce the time of diagnosis. In average, the diagnosis is around 2 to 5 years in the countries that have a good follow-up or good testing. But in other countries, maybe you can wait until 7 to 9 years. And because from the beginning of the disease, the muscle start to get some risk and problems, you don't have the early treatment in order to stop the deterioration of the muscles, also you miss maybe months or years of a specific treatment and then decrease the quality of life or get more progression of the disease. Then the importance to get an early diagnosis, because early diagnosis is early treatment, is better quality of life, and are better outcomes.
Perfect. So, with that said, the best thing to do would be talk to your doctor, correct? If you feel that there are any signs or symptoms or any concern, they should reach out to their providers.
Correct. That is the most important part. As mentioned, this lecture is only to explain you what is the condition, what is the next steps that you need to follow up with your pediatrician, with your primary care physician, and then get the final solution in order to get testing, diagnosis, or treatment for your kid that have this kind of condition. Also, you can find you have a different source of information about the disease that is currently available, is in English, in Spanish, and also you can see what is the information or the connection between the centers of care, center of excellence, or centers of treatment that maybe help your kid that have this kind of condition.
Thank you, Dr. Estevan. Thank you so much for this information. Thank you for joining us today. Thank you, everyone, for joining us. Um, have a great evening.
Thank you so much.